All right.
Bismillah, alhamdulillah, sallallahu alaihi wa sallam, wa sahbihi ajma'in. Alhamdulillah, thank you all for joining the Getting Ready for Hajj series webinar with Dr. Samad Khan. Mashallah, he's been with us with Legacy Hajj previously, and mashallah, his extensive knowledge. Of course, he's a medical doctor, and he will be discussing with us medical advice and health pro tips. So I'll just let him go ahead and get started. Bismillah.
Bismillah, salatu wassalamu alaikum ya Rasulullah, Abdullah min shaitanir rajim. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. So good to have you guys here and so excited for all of you, alhamdulillah, in this amazing journey of Hajj. I still remember, about 4 years, 5 years ago now was my first Hajj that I went on, and it's an unforgettable experience. So many emotions, so many ups, a few downs, but alhamdulillah, it's a journey of a lifetime. I'm sure you heard that before, but I just wanted to reiterate that. And along with that, it's our job and a Legacy Institute with Sheikh Hasib. I'm sure you've already dealt with him and his amazing group of advisors and team that he has. It's our job to get you ready to optimize your 14 days, 21 days, or whatever your package is in Mecca and Medina, so that inshallah that your Hajj is accepted and that you have an optimal time during that Hajj. So with that, I will begin the medical advice and health pro tips journey, inshallah. So really, this Hajj is a medical endurance event. Um, you could call it that. It really tests the limits of your physical, emotional, mental health, and it's very, very important. Half the battle is like just getting ready, being prepared for it, so that when you're there, there will be hiccups, there will be issues that occur, but trying to minimize and mitigate those issues is our job. So. mm, uh, So we'll start off with the basic required vaccines for Hajj. Really, the only one that's absolutely required is the meningitis vaccine. So I'm pretty sure most of you have already gotten it. If you have not, you should definitely get it 10 days prior to your arrival. And it should be written on there somewhere that, the date that you got it done. They'll be looking for that. And it's the quadvalent, it's the ACYW vaccine. That's the most recommended one. And it should not exceed 3 years. That's very important. They also have the conjugated vaccine, and that's done within the last 5 years, and uh, also 10 days before arrival. You should definitely have that done as well. The other vaccines, really not for any Westerners. I mean, they're still recommending these boosters for COVID, but it's not something that I would say if you're at risk, in terms of, you have, chronic conditions, you should speak to your primary care physician, and kind of seek their advice. But the one that is required is the meningitis vaccine. Now, in terms of like influenza, again, I would probably recommend if there's little kids or if you're over 65 or if you have chronic health conditions that you should get that. But again, really talk to your primary care doctor and see what they have to say regarding that. The pneumococcal vaccine as well for people over 65. These other ones like yellow fever, you don't have to worry about those. Alhamdulillah. So certain health risks related to Hajj and Umrah, right? So we'll be going through all of these kind of in depth, but on the surface, like crowding is definitely obviously a health risk. 2.5 million people or so last year, so it should be around there or more this year. So obviously with that comes a whole host of risks of infections, of overcrowding, of falling, things like that. So just be wary of that. The weather, we'll be talking about, how to avoid, certain things like heat stroke, heat exhaustion, dehydration, sunburns, accident injuries. These things are inevitable. It happens every year. So minimizing those with, proper footwear as well. And then talking about like water intake and then types of food and how to avoid, diarrhea, how to avoid GI issues, insect bites, as well as going through different types of infections that the upper respiratory infection, which everybody talks about, which around 80 to 90% of Hajis, unfortunately end up having this Hajj cough. So we'll talk to you about that as well. In terms of fatigue and dehydration, so certain causes for that. So, in general, causes would be like vomiting, diarrhea, fever, excessive urination for a diabetic, excessive sweating. Now, obviously, during Hajj, this is increased a lot more fold. Some of the symptoms of dehydration, so feeling tired. If you're severely dehydrated, you could develop nausea and vomiting. You can develop, obviously you're going to have severe thirst. You'll have dry mouth, lips, and eyes as well. Your heart rate will go up, and your urine will be a lot darker than it normally is. Or you're not urinating for long periods of time is also a sign of dehydration to look out for. Like I said, there's going to be a lot of walking. This is, a medical endurance event. Here are just some, estimates on the distances. Now, alhamdulillah, with the packages that you guys have, a lot of these you'll be either on a bus or a train, but in some instances you'll be walking, right? So the one that most people will end up having to do some kind of walking is when you're going like from Mecca to Mina and back to do your tawafs. Sometimes, public transportation or buses or cars, I mean, it's just so crowded that most people do end up walking. And so, I mean, the average Haji, walks around 20 plus kilometers. I mean, during the entire, Hajj. So, just look out for that, right? So if you haven't started moving around much, this is the time to do it, right? Start walking now. Preferably in, an outdoor setting, where it's a little hot. If it's not hot where you are, the weather is still cool. I would maybe go, say in a sauna, try to get that heat, try to feel it a little bit more, as much as you can, because the temperatures, are climbing. They've been nice, but they're going to be increasing. It's over 100 degrees now during the day, and that sun is very, very, very hot here. I don't know if you guys have not been to the Middle East, or Mecca or Medina. The sun is it's very hot, and you can definitely develop symptoms of dehydration and fatigue if you're not, beginning to get prepared for it. The other thing that I want to talk to you about was, obviously fluid hydration, right? So the average person loses, a few liters of water throughout the day. So the target is about 3 to 3.5 liters of water daily. Now, we don't want you to drink that all at once. So you have to spread it out throughout the day. Sip continuously, and then add these electrolytes, packages. So make sure that's in your health kit that you're bringing with you, or your bags that you're bringing with you. So electrolyte powder, really any type of electrolyte powder that has sodium, potassium, these other electrolytes in them. Make sure that you're bringing those so you can add them to whatever water bottles that you guys are carrying with you. If we don't have electrolytes, like a little bit of lemon with salted lemon squeezed into a water bottle will suffice. Limit your caffeine intake. That's important. as well as watching your urine to make sure, like the color. So if it's normal lighter yellow color, that's good. If it's starting to get darker, if it's starting to turn brown, then you know that you need to increase your hydration. Um, Avoiding heat. So during peak hours of sunlight, definitely, carry an umbrella with you. It should be like a light colored umbrella to block some of the UV rays. Spray fans are very important. Make sure you bring those with you. Keep yourself cool. Spray yourself down consistently. Try to take rest as much as you can. Be in the shade. Wear light, loose clothing, like if you're wearing an abaya or thobe, make sure it's light, cotton. And then obviously drink lots of Zamzam. Zamzam itself has a lot of properties in it that help in hydration, right? And studies have shown that. So drink as much Zamzam as you can. Here's just kind of like a map of from Mecca to Arafat. All the way from Mecca to Arafat. So in the middle, you'll have Jamarat, and then Mina, and then the longest journey is from Mina to Arafat. Most of you guys will either be taking the train or a bus. Um, Now, coming back from Arafat to Muzdalifah, you know, I mean, there's a lot of people that walk. There's people that take buses. There's people that take trains, cars, etc. But there are instances here where you'll be walking. Alhamdulillah, when I did my Hajj, I was I was a little cavalier, and I walked from the tent in Mina, which is by Jamarat, all the way to Arafat. Alhamdulillah, but that probably wasn't the best idea. I almost developed a heat stroke due to that. So, not recommended, mostly in the heat. And if you're not, kind of in fitness and in these type of things, really focus on your ibadah. You don't have to be cavalier. It's, when you get there, I'm telling you, you're going to be very excited. Your adrenaline's going to be flowing. You're going to be, wanting to, do all these things. A lot of people start, doing extra tawaf, and they want to do like multiple umrahs before they start Hajj. And, I would definitely recommend just try to rest as much as you can before Hajj. Don't overexert yourself. The last thing you want is, something to happen where, Hajj becomes more difficult for you to complete. So this is important, right? Distinguishing between heat exhaustion and a heat stroke. Okay. So heat exhaustion is when you're, feeling faint or dizzy, when you're sweating a lot, when your skin is kind of cold or clammy, you have some nausea or vomiting, and you have muscle cramps. Heat exhaustion is something that you should watch out for. It's not technically a medical emergency, but it could potentially be leading to what they call heat stroke. And heat stroke is deadly, right? It can actually, cause significant issues and possible death. So it's something to definitely watch out for. So heat stroke is a little different. Heat stroke is when you become confused. So if you're with somebody who's been out in the sun and they're talking, but they're incoherent and they're kind of blabbing about this and that, they're feeling dizzy. That's a time where you should call the paramedics immediately, take that person into a cooler area, and then cool them with water or ice right away. To avoid heat stress, these are some guidelines. I mean, try your best to avoid hot and crowded areas. Sometimes you're not going to be able to do that, right? When you're, you know, uh, getting off the train and you're, going to Jamarat or you're going back to your tent, there's going to be mass amount of crowds when you're going to Muzdalifah. You're going to be with, tens of thousands, hundreds of thousands of people, and you know, you don't walk in the opposite direction of where you're supposed to go. Obviously follow the crowds. It's very important to do that. Sometimes people will want to wait for other people, or they'll be, maybe they'll get lost and they'll try to backtrack. Those are all things that can lead to further injuries. Try to avoid direct exposure to the sun. Sheikh Hasib's done an amazing job in, guiding the groups in terms of when to go to Jamarat and when to go back to Mecca to do Tawaf and the best times to do these things. So, alhamdulillah, with his guidance and the team's guidance, we should be okay with that. Take breaks and rest. It's okay. You know, this is not a quick race, right? You have to look at it as like a long marathon. You have to take breaks, rest as much as you can. Obviously, hydrate yourself. Don't eat excessively. It's very important. Try to eat like yogurts, some light cereals, um, some fruits. These are things, light proteins. These are things, you shouldn't be having like, heavy like meals, before the days of Hajj or during the days of Hajj. It brings blood flow to the gut, and it causes increase in risk of dehydration, other types of problems. Use light colored umbrellas. So you'll be seeing a lot of people with a bunch of different types of umbrellas and things like that. Obviously, the light umbrellas, the white ones, reflect more light, as well as clothing. So, try to wear the white colored thobes or abayas. Heat stroke, a medical emergency. So we talked about this. Remove outer clothing. So this is not like a drill, right? So I think 2 years ago when I was with Sheikh, we had multiple instances where people were developing heat stroke, and it was very, very hot. And we're just rushing from one area to the next, trying to get people the medical attention they needed. And so these protocols are very important to know. Remove the outer clothing and cool the body with water, especially the head and the neck areas. Transfer the person to a shaded, cool area. Make sure they're drinking fluids. Expose them to a source of air. So obviously, like a tent where there's air conditioning will help cool the body a lot more. Call for emergency medical services and proceed to the nearest healthcare facility. Now let's talk about women's health a little bit. It's very important. This is a topic that always comes up every year, and mainly to do with like menstrual cycles and how to, delay menstruation, during Hajj. So pregnancy in Hajj and Umrah. Again, speak to your doctor if you're pregnant. Most important thing. Everybody's cases are unique, and the best person to speak to regarding this is your personal physician. There's some recommendations here. Again, talk to your doctor, but preterm birth risk, early risk of miscarriage, if you're pregnant with diabetes, preeclampsia, if you're pregnant and you have hypertension, heart disease, kidney disease, and if you have increased risk of bleeding during pregnancy. These are all things in which you should definitely talk to your doctor before attending Hajj. Menstrual period. So there's three different types of oral contraceptives that are used during Hajj and Umrah. Again, this is something you should talk to your OB/GYN about because everybody's a little unique. There's little differences between each of them, and everybody has potential different side effects based on who you are, things like that. So there are side effects to these things: nausea, vomiting, headaches, breast tenderness, mood swings, emotional irritability, also breakthrough bleeding you can get from OCPs. NSAIDs do help with period pains as well as bleeding. It's not recommended to take birth control pills if you have some of these issues, but again, speak to your doctor. If you have high blood pressure, heart, liver, kidney disease, again, there's higher risks if you're older than 35, if you've had a baby recently, within 6 weeks, so pretty recently, if you have extremely high cholesterol, or obviously if you're not sure if you're pregnant or not. Um, And then I think you guys can. Do we want to shake? Do we want to wait till the end to ask questions, or can they interrupt in the middle of this talk? I think we'll just wait till we finish, and then we can ask questions. We have an hour and a half, so inshallah. So there's three options here. The first one, I'll tell you the most, the recommended one, but on the list here we have number one, which is OCPs, which is a combined estrogen progesterone pill. Um, Basically it's a pill that you probably taking anyways if you're taking a pill, and then you have the full 21-day pack, and then you have like a 7-day on the bottom that's for breakthrough bleeding, so that you uh, you'd actually don't take that. You don't take the placebo, and you just start immediately on the next packet, so you're avoiding the placebo, which brings on the menstrual cycle, so you'll just continue taking that. um, Mentioned here, right? You take the 21-day pill and then skip the 7-day break and start the new packet right away. You must take this 1 to 2 months prior to Hajj and Umrah for better results, and you have to stay consistent with the timings as well. The other option is progesterone only. So Provera, that's a 10 milligram pill, 2 to 3 times daily. You start that 3 to 5 days before your period starts. Again, this is a little bit less common. And then the one that most people do take is this Primulat N, which is a 5 milligram pill, and you take it 3 times daily, right? Make sure you start it 3 days before your expected period. Most, women that do come for Hajj and Umrah, this is what most physicians would recommend to them. They are safer than regular OCPs. They don't increase the risk of blood clots as much as the other ones do, and they're better at, the breakthrough bleeding, so they don't cause as much breakthrough bleeding as the other pills do. Again, there is a chance of breakthrough bleeding even on this pill. We've seen it happen, and when it comes to that, I think you can talk to Sheikh Hasib or some of the other sheikhs regarding like what to do about those things. Again, what can be done about breakthrough bleeding. And I don't know if there's a separate women's kind of seminar that we're going to do this year. We can ask Sheikh. Sometimes we do that because there's a lot of other topics that come up. So, but again, what can be done about breakthrough bleeding? Stay on schedule. That's the most important thing. Most people will get off schedule and then they'll be like, "How am I having this breakthrough bleeding?" And it's because you're not taking the pills on time when you're supposed to take them, and so it throws off the kind of throws off the hormones, and then bleeding occurs. Track the breakthrough bleeding in a regular calendar or diary. It's something that you can talk to your doctor about if you do have it. If you're smoking, this is increased risk of breakthrough bleeding as well. So try not to smoke. Other common conditions. So the Hajj cough, that's something that we're going to talk about. GI disease, food poisoning, diarrhea, skin issues like sunburn, allergies, and we did talk about dehydration. Um, so when you do come for a Hajj, make sure that you use your original pill bottles for all of your medications that are prescribed. It's very important because sometimes, the authorities will look through, and if they're in bags or if they're in other things, then, they'll get confused and it might become an issue, as well as, if they're misplaced or if it's really important that you have them in the original pill bottles. Always bring an extra, few weeks of medications with you just in case. And make sure you bring them on your carry-on with you, just in case your suitcase gets lost or misplaced or something like that happens. You do have them with you on your persons. Um, So yeah, carry documentation. If you do have like a long list of health conditions, chronic medical issues or severe medical issues, make sure you have like a summary of your medical conditions, and like your doctor can print that out for you. Carry that on you, just in case there's an emergency and people need to figure out what's happening. You have that list on you. Also, medical bracelets are important as well. Talk to your doctor about those things. So for hypertension, bring your blood pressure medications. You can bring the machine as well to check your blood pressure. There's so many different things that can happen during Hajj, which can kind of alter blood pressures. Obviously, you can get increase in blood pressures with things like stress. So, if you need to check your blood pressure, you can bring a blood pressure monitor with you. There are a lot more health stations where you can get your blood pressure checked as well. So make sure you bring your medications. If you have angina, make sure you bring your nitroglycerin. Make sure for diabetics, you're having to bring, something where you can put your insulin in where it's not gonna obviously overheat. Avoid salt if you can. Obviously you're going to be in a different setting when you're at Hajj, so try to avoid eating really salty foods. Eat in moderation, and then the portable blood pressure cuff, which we spoke about. For diabetes, there's a lot of diabetics. Diabetes, is something that obviously it's a little bit more difficult to control during Hajj, right? Episodes of hypoglycemia can occur with stressors, with changes in dietary protocols, with dehydration. Make sure you bring a glucometer with you. Adjust medicines if your diet is decreased. Always have a snack on you. Most diabetics know that, anyways. Store your insulin properly. Protect your feet, right? So it's very important that any little scrape, toe scrape, something like that that happens when you're walking for so long, this can multiply if you're a diabetic. And so make sure that you have the you know, uh, uh, proper shoes or sandals to wear. There are some different types of shoes and sandals, like the names of them that I can talk to you guys about afterwards. Um, Again, avoid excessive sugary foods and sweets. Excessively high blood sugars may obviously be very harmful to your health. Symptoms of hyperglycemia are hypoglycemia, so severe fatigue, blurry vision, sweating, somebody who's shaking a lot, shivering, dizziness, lightheadedness, or agitation. These are signs and symptoms of potential hyper or hypoglycemia. Asthma, COPD, bronchitis. This is an issue because there's a lot of dust in Mecca and Medina, and with obviously dust, you can exacerbate asthma symptoms. If it's very hot, it's very crowded. So bring your inhalers. I would bring an extra albuterol inhaler with you if you have one. In general, I would bring an extra one with you just in case. Um, Antihistamines. So if you do have any history of allergies, make sure you bring some, Claritin, Zyrtec, Singulair, just because you don't know the environment, you don't know what your triggers are potentially, and a lot of times dust can trigger uh, allergies. Um, Bring a course of steroids, potentially like a Medrol dose pack. Again, talk to your doctor if they think this is advisable. I usually try to bring like some antibiotics with me, like a Augmentin, a Z pack, and a Medrol dose pack. Sometimes the lines to the like in the pharmacy is they're very, very, very long, and just trying to get an antibiotic can take a very long time. So talk to your doctor if you can bring like a Medrol dose pack, which is prednisone, a tapering dose of prednisone, or your antibiotics. I would recommend doing that. Um, if we do have a history of chronic asthma, COPD, bring portable nebulizer solution with you to make sure you don't forget that. If you do have COPD, make sure you bring a pulse ox with you. Again, I would bring a one extra of all of these just in case. And then wearing face mask. That's something you can talk to the sheikh about regarding, if it's something that, um, obviously with, I don't, I'm not going to get into what you can do, what you can't do in terms of Hajj, but, if it's something that, you have to do and you need to pay a penalty for, then, I would recommend that. If you do have a history of seizures, make sure your group leader knows. Make sure that you're taking your medications. You're taking electrolytes, right? Dehydration can bring on seizures. Avoid excessive straining and stress, and then bring your abortive medications as needed with you. And have somebody that knows that you do have a history of it, like maybe wear a bracelet or have documentation on you that you do have a history of seizures and what to do if that occurs. So this is a very common occurrence, edema, leg swelling. Again, talk to your doctor if it's a chronic issue and they do recommend taking a blood thinner or aspirin, then that's something that you should talk to them about. But compression socks is something that I would bring. You're going to be standing for a very long time, and then people can definitely you'll start seeing yourself having some edema in your lower extremities, and if it gets really bad, then it becomes a lot more difficult, a lot more painful to walk around. So at that point, you can wear compression stockings. Try to avoid salt intake as much as you can, and then if it's really bad, you can take Advil or Tylenol for any severe issues. Uh, if you do have dialysis, if you do have chronic kidney disease and you're on dialysis, make sure that you discuss that with your group leaders before you come. And then it's important to avoid fluid overloading as well as salts, things like that. Bladder issues. So, people have this issue like finding bathrooms and sometimes they're holding their urine a lot more than usual, and this can lead to issues. Again, talk to your doctor. There's some people that do take medications that prevent you from urinating as much. I'm not a big fan of that. I think that it's there are enough facilities now, alhamdulillah, that you can find a place to use the bathroom. Previously, when you would go to places like Arafat, it'd be difficult to find a place. Now, alhamdulillah, they've added a lot more bathroom stalls everywhere. So, um, yeah, it's becoming less of an issue. If you do smoke, I would say try to stop quitting now. It's just going to add, issues when you're during Hajj. Really, like if you're trying to stop during Hajj, or if you're then you can have irritability, sleep issues, things like that, cravings, all detractors from really what you're trying to do. There are patches, things like that you can do, supportive care, antidepressants. So I would definitely talk to your doctor and try to avoid these things as much as you can. You should try to have a clear mind, clear body before you come here in this beautiful place. Things like anxiety, panic attack, claustrophobia. So these are potential issues. You know, you're going to be in crowded places. You're going to be in places that you're going to be around more people than you ever have in your entire life, and sometimes you're going to be in tight corridors where you really can't maneuver too much, and this can potentially lead to anxiety, panic attacks, claustrophobia, right? So even if you don't think you have it, it could potentially present itself. So if you do feel like you have a condition already, then talk to your group leader. There are, certain breathing techniques. You can go on YouTube and look at how to do that. Avoid crowded areas. Again, we're going to help you with that. So try to get you to, you know, s- do the stoning times where there's not many people, or try to go do tawaf back in Mecca when there aren't as many people around, things like that, that, can mitigate these issues. Um, for insomnia, again, melatonin's there. You can take some magnesium. So if you're having sleep issues, maybe, bring a little bit of melatonin or magnesium to help, because, again, a lot of people have an issue with sleep. Not in Muzdalifah though, inshallah. Muzdalifah, alhamdulillah, you're going to sleep really well. Best sleep of your life. Um, some pro tips for guys, Vaseline. There's chafing that occurs in the groin area, and if you don't use Vaseline, it can get very, very uncomfortable. Avoid that situation completely, right? And use Vaseline in those areas. Unscented soaps, bring these with you. Sometimes the hotels, things like that, they don't use unscented soap. Again, this fiqhy stuff you can talk to Sheikh about, but if you just want to be careful, you can bring your own unscented soaps, and then wipes, tissues. Make sure you have those on you at all times. Try to use sanitizer. Um, make sure it's greater than 50 or 60% alcohol. Use sanitizer, use, hand washing, use wipes as much as you can. I would say like try to do it every 30 or 40 minutes to avoid, developing any kind of respiratory or any type of disease. Um, Start walking now, condition yourself, be physically prepared. This is the most important thing. You don't want to, have these issues where, you can't get around, or you're so exhausted that you can't perform the rituals that you want to perform because of a lack of conditioning, right? So, if you're not walking at all, try to get outside. The weather, in the States for the most part is really nice right now. So get outside, walk around, increase that as much as you can. um, Diet, start now, start changing your diet now so that it's not causing a GI disturbance. That if you're eating one type of food all the way up until Hajj, and then when Hajj starts, you're eating different types of food, it's going to cause a GI issue where you're going to have to use a bathroom, or it's going to maybe cause some diarrhea. And so try to incorporate some of those things into your diet now. Avoid fast foods. You're gonna see like El Baik everywhere, and all these amazing food like places that people have seen on Instagram and TikTok, and you're gonna want to eat those foods. I'm telling you, but try to avoid them as much as you can. During the days of Hajj, because they're heavy, they're greasy, they keep you. You're not optimized. And then good, comfortable sandals is very important. And make sure you're not getting sandals and you're just taking them out of the package uh, right before you come. That's probably one of the worst things that people do, and they develop blisters, and it becomes very painful to walk around. Wear in your sandals that you're going to be wearing for Hajj. Wear them in, walk around with them, make sure they're comfortable. This is something that you might think is trivial, but it becomes very, very, very important for you. Again, the antihistamine for urinary retention, I don't know. I mean, talk to your doctor about that. Like I said, wash your hands regularly, change your clothes as much as you can. Alcohol sanitizer is fine, I think. And then get an extra pair of glasses. Again, you're going to be intense, you're going to be moving around quite a bit. God forbid something happens and your glasses, get broken. We still want you to be able to see. And, Sheikh Hasib can't be everywhere all the time. He's gonna wanna walk every one of you guys, alhamdulillah, through all of Hajj, but he can't. So, make sure that you're optimizing yourself and get an extra pair of glasses. Chronic health conditions. So this upper respiratory infection, right? So it's very common. It's almost inevitable when you develop a Hajj cough. Okay. And it's pretty rough. Most of the time it's a dry cough and it lasts, throughout Hajj and afterwards when you come back, you can be coughing quite a bit. Most of the time it's viral. We do recommend that if it becomes persistent or severe, that you do take an antibiotic for it. And that would be either a Z-Pak or something like Augmentin. Um, when you're coughing or sneezing, obviously cough into your arm. If there's no tissues available, you can do that. Again, use face masks in crowded areas. If you have to pay fidya or fine, you can talk to Sheikh about that. But again, I would recommend wearing a mask in times where you don't, where you can wear a mask. Uh, yeah, so food, eating food like on days of Arafat, where it's really hot outside and the food's been sitting out for a while, I would try to avoid eating like the meat that's been sitting out for a while. Food that's been exposed to insects or heat, try to avoid. Wash your hands regularly. Canned foods, drinks like that. Verify expiration dates. Um, wash your fruit and vegetables before you eat them. It's very important that you do that. Um, So certain medications to bring with you. Uh, Again, these are just recommendations. Pepto-Bismol, Imodium for GI issues, like Flonase if you have allergies would be helpful. Allergy medications like Allegra, Zyrtec, cough drops, um, Vaseline, something like Airborne. Definitely vitamin C is something I would start taking even before you come. Um, And then Tylenol, Motrin, things like that. Wet wipes would be important as well. Make sure you have a list of your medications, antibiotics. The Doxy and the Cipro is really for GI, like really bad GI issues. Um, you can bring a Z-Pak and or amoxicillin slash Augmentin. Again, talk to your doctor if he recommends that or not. Usually, do people do bring them, and I would recommend it because, again, the lines could be very long here in terms of getting an antibiotic. Um, Steroids potentially for nausea, vomiting. You can bring Zofran, Benadryl, hydrocortisone cream would be good in case you get like insect bite, something like that, and then pain medications. Um, Seek medical help if you develop chest pain, pain spreading from the chest to other places, such as your arm to your back. If you develop a sudden shortness of breath, if you get dizzy or imbalanced, if you have excessive sweating, or if you develop stroke-like symptoms. I think this is still the number 937 for any health inquiries. And they answer in multiple different languages. Returning back from Hajj, there's something which they call like post Hajj blues. Um, it's potentially there. It would be something to look out for. If it lasts more than a month, you should definitely go see your primary care doctor about that because then it can turn into something called depression, things like that. So, because you're on this high for so long that when you come back, there's potential that, you're sick, you're tired, you have to, maybe people have to go back to work right away and they get a little depressed. Antibiotics. So again, if this Hajj cough lasts more than a week after you get back, I would recommend getting on an antibiotic at that point. Um, Vitamins that you can bring: vitamin D, B12, vitamin C, multivitamin, zinc, magnesium if you're sick for sleep. Um, I don't have to worry about this for kids. Uh, There's some basics, sunnah health, for example, like miswak is very important. Carrying one around, it definitely helps. Um, um, don't waste food. I mean, this is something, from the Sunnah, right? There's going to be a lot of food around. There's going to be like when you're in Mina, you're going to have so many different freezers and compartments where you can go and get like the ice cream sandwich and go get, some bread and drinks. And, you're going to have a lot of food around. Don't waste food. You don't want to like lose the good deeds that you're getting in Hajj by like silly things like that. So just don't throw away foods. There's so many workers and things like that that if you have, food that's uh, you haven't finished, they'll finish it for you. Drink lots of Zamzam. It's the best water on the face of this earth. Alhamdulillah. Um, you know, uh, some of these things like dates, honey, black seed. These are all mashallah from the Sunnah. So you can bring those with you. Uh, okay. See, I think we have some time for Q&A now. If anybody wants to ask any questions, is everybody muted on this
Can you hear
chat?
me?
Yes, yes, I can hear you. Yes.
Yeah, I did the whole hand raising thing. Do you want to do that or just go for
Oh,
it?
yeah, yeah. No, I didn't know. I mean, whatever you guys want to do, man. It's all good. Alhamdulillah.
I got a few quick ones then. I'll just kind of jump in.
Yeah, no problem.
So you mentioned a few different things, and I noticed on your medication list, for example, you had Imodium and Pepto. Do you recommend
Yeah.
both, or is it one or the other? And what's
I
what's
mean,
kind of the differentiator there?
no, so for example, like if you're having really bad diarrhea, right, and you need to like avoid going to the bathroom that much, then you can take the Imodium. Yeah, I would recommend that. Pepto's more for like if you're having like stomach pains, you can take Pepto to get rid of those as well as some people develop GERD, which is like the burning,
Hmm.
maybe the food's coming up in there, so you can bring like a Zantac if you want. But yeah, the Imodium would be good, I think, if you're having excessive diarrhea. You don't want to have issues when you're mostly during the days of Hajj. You know.
Gotcha. And then on the electrolytes, when would you recommend we take them, right? Is that when you start feeling like you're kind of
No,
dehydrated, or
no,
do you
no,
take them in
no.
the morning?
I would start taking them. I would start taking them like as soon as you get to Mecca, and in all of your bottles of water, I would recommend taking them, um, mostly during the days of Hajj. Yeah.
Okay, so you would recommend like the powder that goes in the bottle over like a chewable, like salt stick or something like that?
I think any of those work, but
Okay.
I think the powder is the people that I think most people end up using the powder because
Hmm.
you can take it. You're taking it with the fluid that you're bringing, right? So
Hmm.
instead of like figuring out like how much am I supposed to take outside of the water fluid intake,
Hmm.
so taking it with the fluid is preferable.
Okay, and then last question, and I'll just ask. It's kind of a combo question. Um, it's another one: Vaseline versus Aquifer, and then any multivitamin recommendations?
Yeah, Vaseline versus Aqua. I personally like Aquaphor, honestly. It's it feels like it works better in general, and a lot of the dermatologists recommend Aquaphor over Vaseline anyways. So
Mhm.
that's the personal preference. What was the other question? Sorry.
Just multivitamins. Any multivitamin recommendations aside from vitamin C?
Yeah, again, I wouldn't necessarily start taking a bunch of new vitamins when you're coming on a trip because if your body, kind of reacts to it, or if, your body's not used to it, and it can, cause rashes or it can cause some GI issues. You're not gonna really know what's going on at that point. Um, so, again, you can take, I would say, the magnesium for sleep potentially. So it shouldn't just be like a multivitamin. It should be like, if you're having an issue, like for example, you're having an issue with sleep, you take magnesium, right? If you're taking B12 already, bring B12. I wouldn't start taking it. Vitamin D, really, you're gonna get a lot of vitamin D anyways, in the sunlight more than you probably have gotten ever before. So I don't necessarily think you should bring multivitamins with you necessarily, man. Uh, I think Joaria question.
Assalamualaikum.
Well,
Um, can men wear sunglasses in Iran?
think so.
Okay. Okay, just making sure. And the other
Yeah.
question was, if we do end up like using a mask or something, like what's the fidya? Or if we're
Yeah,
using,
again, I'm not I'm not
oh, so he's not
I'm
here?
not the sheikh, but
Okay.
no, it's a good question. It's a really good question, and it's a question that sheikh will that you'll know before you come, because again, it's mostly when COVID was around, everybody was asking these questions, and I think it's worth paying the money, personally, but
Yes, because I'll have, I think women can wear a mask, can they?
I don't know. I don't necessarily think so, but yeah, I mean, we're gonna have to, like, because it depends, like a fiqh thing, right? So like
Sure.
whoever your sheikh is, who you're coming with, Sheikh Hasib, he'll give the best direction on that. I don't want to say something that's off and then becomes an issue.
Okay, sounds good. Jazakallah khair.
Well, yeah.
Uh-huh.
Sounds good. Yeah, and if there's other issues, like I know there's a lot more like women stuff. So if the women want to have their own kind of talk, then maybe we could do that at a separate time, and Sheikh can organize that. I did that last year and it was pretty good. So thank you very much for your time. Hope that was informative a little bit. And again, if you guys have more questions about anything, I can always, reintroduce, or I maybe Shay can give you my number or my email, and you guys can ask me. Inshallah. Inshallah. جزاك الله خير إن شاء الله. السلام عليكم ورحمة الله وبركاته.